Thank you for looking at our video channel. This is West Chase Wellness Chiropractic Center. My name is Dr. John Huang. I'm going to demonstrate what a adjustment looks like in my office. Here we go. I use the drop table technique to get people a neck to kind of go back to have a proper curvature. A lot of time people use cell phone or computer and they're on this position, and the necks typically have a straight curvature or what we call it reverse curvature. And what we're going to do is adjust that area to restore the proper curvature in your spine. Here we go, in the neck area, like that. We're going to do that one more time here. Good. I'm going to do one more time just to make sure the table has the right tension on it. Awesome. Now we're going to work on the little bit discomfort that she has in the upper back here. I'm going to drop here and push down like that. And ultimately, we wanted to affect the curvature of the spine. You're born with full curvature. First place, the curvature is the neck. Second is this upper back here. Third is the lower back. And fourth is the sacrum. We're going to adjust the whole spine on her. When people get rig adjustment, for example, in the upper back here, right now for asthma, for example, good for the lung and the heart. Just help them breathe better. If you're an athlete, this is a good to get regular adjustment to perform better. I'm a marathon runner and also a cyclist, and I do those things to improve my health. I get regular adjustment. My family all get regular adjustment, including my staff. That was wonderful. Now I'm gonna go down to check the leg right now and see how it looks like. Looks good here. Looks kind of short on the left, just a little bit. I'm gonna calibrate the table to put the tension on the table to drop the table again, like that. Do that a few more times. Very good. Okay, here to do this here. Very good. Do here, just like that. Just like that. Now we're gonna get lumbar adjustment a little bit. Good. Good. Good, there we go. That was wonderful. Verify how the adjustment went for her. Went very well. I like those shoes, by the way.
Thank you.
Nice and warm and comfy. There we go. Very nice here. See, just a slight tightness on the left side. Do that again. Wonderful. Wonderful. All right. Now what we're going to do is we're going to adjust the spine from the lower back up to upper back. Okay, breathe in and hold your breath. Just hold your breath. Breathe out. That's wonderful. Good. Come on the other side here. Good. Okay, turn on your side. Face me, please. Go this way. Good job. Good. Very good. Awesome. Breathe in. Breathe out. Good. Good. Other side for me. Good job. Good job. There we go. Awesome there. Breathe in. Breathe out. Good. 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 Okay, on your back face up. Good job. Good. You're feeling a lot better, I can tell. Good. I'm going to get the wrist adjustment here. I just do that, and I'm going to adjust the thumb. Wonderful. Good. 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 The elbow. Good. That was wonderful. get the ankle for you to demonstrate how ankle looks like. Should be a lot of movement. There we go. That's a lot of crack right there. Do this side. Good. That was a good one. Very good. Come with this elbow here. This wrist gives me. That's a nice loud crack right there. Good. Good. Let's get the elbow. Very good. Let's get the neck now. Just relaxing my hand. That was a nice loud crack right there. Good. Oh, no. Ooh, that was really nice. Just her ears to see if she likes that one. There we go. There we go. Now sit up a little bit. Do one more thing before you do a test a little bit. Let me do this for you. Adjust your shoulder. Good. Other side. All right. Your turn to talk a little bit. How's your experience since you've been coming in? I think it's the third or fourth adjustment you've been getting right now, and just tell out there how you've been feeling.
Since I've been coming in, I've had like a lot less tightness because I work in a warehouse, so a lot of that tension builds up. But since I've been coming here, I've had issues with that, less back pain, and like my legs don't hurt as much, and my knees and everything like that. So it's been really well.
Very good, very good. Please like it, subscribe, subscribe, and please share the video for everyone to know what we do in the office. We thank you.